We also have Dr. Renuka Prasad, Secretary, Indian Cancer Society. And we have Mr. Vicky Nanda, COO, Niramay Health Analytics. I would like to thank our speakers to be here, and I invite them to start the session.
Good morning to all of you. The title of this session is Driving AI Impact Through Real-World Action, which came about as a concept during the NXT conference last year and turned into something called the Namo Shakti Rath mission, which is now achieved the status of one of the largest actually, breast cancer screening program in the world. So I'll just start off with saying, good morning to all of you. When we speak about artificial intelligence today, the conversation is often about disruption, scale, valuation, and speed. But here is the real test of innovation. Does it stay inside the conference halls, or does it actually step out and affect people's lives, touch it intrinsically? The NXT conclave was born out of the very question. It was not designed to be another summit of speeches or an applause. It was created as a platform to discuss, track, and implement ideas that create measurable long-term impact. When we conceptualized NXT, the intention was simple: bring policymakers, scientists, entrepreneurs, and industry leaders into one room, not to exchange visiting cards, but to exchange responsibility, not to admire technology, but to deploy it. On the 1st of March 2025, at Bharat Mandapam, right here where we stand, experts demonstrated AI-enabled breast cancer detection technologies. For many in the audience, it was a breakthrough device. For me, it was a moment of clarity, personally. I must share this before I speak any further, because this is something which was very emotionally attached to me. My elder sister, for about 16 years ago, who herself was a doctor, was diagnosed with breast cancer in the 3rd stage. And this is while she was working at Johns Hopkins. And in spite of the fact that she was a doctor, she had problems in knowing that she was plagued with this problem, with this disease. So in this technology exists, why should it remain confined to hospitals in metropolitan cities? Why should awareness, access, and affordability decide survival? Because in India, the breast cancer is not only a medical challenge, it's also social silence. According to the Indian Council of Medical Research, breast cancer accounts for nearly 28% of all cancers in women in India today. And the Globocan estimates more than 2.3 lakh new cases annually, which also results into about 90,000 deaths every year. Every 6 minutes a woman is diagnosed. Every 10 minutes a life is lost. Most cases are detected late, in advanced stages. Survival rates decline, not because science is weak, but because access is delayed. At NXT, we did not want innovation to end with applause. We wanted to travel. That is how Namo Shakti Rath was born. The name Shakti is deeply personal to me, because this is something which I have taken as an inspiration from my mother and all the motherhood that comes with it and the power of women. And the larger vision draws inspiration from our Honorable Prime Minister, who emphasized about preventive healthcare, digital transformation, and last mile delivery that has shaped India so far and will become the bedrock of a foundation of a developed India by 2047. So if we want to be a developed country, we have to have an ecosystem which is conducive for healthcare sector, and especially for the people who need it the most. And that's exactly what the Namo Shakti Rath represents: a confluence of personal conviction and national vision. We chose an AI-enabled, non-invasive, radiation-free screening technology, which is no touch, no exposure, no radiation. It uses thermal imaging integrated with AI-based pattern recognition and automated cloud analysis to generate instant digital reports. It preserves the dignity of women. It respects privacy. But the real innovation is not the device, it is the delivery model. On 17th September, this initiative and the Rath was flagged off in Haryana. On 14th January, it was launched in Varanasi. Today, more than 30,000 screenings have been conducted in Varanasi and Ambala alone. multiple vans. We have about more than 42 of these mobile vans which are operating on a daily basis with a dedicated team, with digital dashboards which track the progress in real time on case-to-case basis. Every participant is registered through secure digital systems. Each screening generates a unique ID, geotagging locations, technician authentication, and encrypted AI reports. This is structured, this is accountable, and it is scalable. This is the AI translated into public health architecture. When a mobile van enters neighborhood, it does more than conduct screening. It breaks stigma, it normalizes conversation, it tells women that early detection is strength and not fear. Earlier, healthcare waited in buildings. Today, healthcare moves on wheels. That is what driving AI impact through real-world action truly means. NXT proved that a conclave can be more than a discussion. It can be a catalyst. It can track ideas beyond the stage. It can convert dialogue into deployment. Artificial intelligence must not remain a lab achievement. It must become a humanitarian instrument. A developed nation is not defined only by GDP growth or digital exports. It is defined by whether its mothers and daughters survive preventable diseases. For me, Shakti is not just a word. It's my mother's blessings. It is every woman's strength. It is the moral force behind this mission. When history looks back at this era, it will not remember how advanced our algorithms were. It will remember whether technology stood with humanity. Namo Shakti Rath is not just a vehicle, it's a moving light, and that light carries dignity, assurance, and hope. I just want to share a few personal instances with you before we start the panel. You know, it was a really heartwarming and a satisfying feeling when you attend these camps, because when people from all walks of life come, I don't think the people working on the project, on the technology, on the quantum aspect or the AI aspect of it would have ever thought that what they are working on will have such a great social impact on Asha Rani in Ambala or Fulo Devi in Varanasi, in terms of what difference it can make. The problem is of awareness as well as the social stigma that remains. While we were curating the technologies, we looked at the Indian problems, the problems that we face in the Indian mindset, which was definitely a big advantage that there was no radiation in this technology, but also the social stigma that came in some parts of rural India was also to be addressed because it was non-touch, non-invasive, and no pain. These are parameters which have helped us expand a campaign and take it to the furthest parts of the country, and which we are expanding on now and taking it to the next level where we are doubling the number of centers. Not only does it provide an alternative to this first step of screening, which is the first point of contact, but also reduces the load on the entire healthcare system to be able to filter in and funnel those cases which have been defined because of the rates of efficacy and specificity, which is about 95% through this technology. So I will not take more time. I will just ask the panel to start the conversation so we can have a dialogue which is more relevant and related to the issue at hand. Thank you very much.